So the idea is to use as much information as we can to identify women who are at risk for breast cancer. And then that way we can focus on them to use mammography screening and other prevention methods to be able to detect cancer early. And so most of my research has been on genetic susceptibility to cancer among women without family history. And so this way we can identify women who are at risk. And so normally we start mammography at the age of 50, and this way we can identify women who should probably start screening a bit earlier. So we use genetic markers. It's a published panel of over 300 markers. And then we also use reproductive history and some other lifestyle factors. It's becoming very clear that prevention is probably much better than cure, and it costs a lot less to treat a much earlier stage breast cancer than it does a later stage breast cancer. And so if we can start catching them when they're stage 0 or stage 1, then it's easier to treat them than it is if it's stage 2, 3, or 4. The resources are limited pretty much everywhere for screening. And so if we can use a tool like Prevent to be able to focus the screening resources that we have today on those who need it most, we'll gain in efficiency. And so I think it's really good in the Latin American market, and pretty much any place else for that matter, where participation rates in mammography programs are low, to be able to say, well, we really need to be getting the people that need it most into the programs so that we can help them the most. So it's not being used currently. We just launched a couple weeks ago, actually. So we're just getting started, and we're looking forward to setting up our first partnerships here and working with gynecologists, general practitioners, and other doctors as well. So the near-term goal is to really focus on diseases where we already have established prevention and treatment regimes, so like colorectal cancer, cardiovascular disease, and diabetes. But I think the more long-term aspect of this is we're starting to see that not only germline genetics, so these polymorphisms that we're looking at, but also other factors can influence response to treatment and survival in people who are already sick, so what we call tertiary prevention. And so we can couple that on to the end of this primary and secondary prevention that we're already doing and get into tertiary prevention after that as well. So I already had a pretty good idea, being a population geneticist, the challenges that we face in places like Latin America. And I think it's important to really be more proactive in letting people know how we're dealing with the differences that we can see even within one country in terms of the genetics, but also the socioeconomics of how things work as well. And that's something that is important to keep in mind as we're developing these tests.